So what is a service-connected disability, and what do you need? What evidence do you need for a service-connected disability? The first thing that you need, if you're a veteran filing for disability benefits, is you should have a current diagnosis of a chronic medical condition. Chronic is important. You can't have benefits for something that's acute that goes away. You have to have something that lasts longer than 6 months. The VA defines a disability as a condition which causes a loss of function. And loss of function is very broad. Loss of function can be a medical condition that lowers your health. It can be a condition which causes chronic pain and limits your activity. It can be a condition, a medical condition that causes chronic symptoms like acid reflux, or a musculoskeletal problem like a knee that has pain, a joint that has pain. Any of these things cause a loss of function. And if they last longer than 6 months, they would be eligible for disability benefits if it's service connected. And that's the second piece of evidence that you really need to show that you deserve disability benefits from the VA. You have to show evidence of a nexus for your VA disability claim. A nexus is simply a link. And the burden of proof is low. You only have to show that it's at least as likely as not that you would not have your current condition if it were not for your active duty military service. And for a lot of things, that can be pretty easy. That hurdle can be quite easy for some conditions. For a secondary condition, you need to show that your current diagnosed chronic medical condition is at least as likely as not secondary or caused by your current service-connected condition. So let me give you an example. You're service-connected for high blood pressure, okay? And you take high blood pressure medications. And because of those blood pressure medications, now you have erectile dysfunction. Now your doctor may have even told you, listen, I'm going to prescribe you something for your erectile dysfunction because your blood pressure medicines are most likely causing that problem. As a veteran, service-connected for high blood pressure, who now is experiencing a secondary condition that is most likely caused by the primary condition, you are automatically eligible for disability benefits for that condition. So for a direct claim, that's a secondary claim. For a direct claim, directly related to active duty military service, you must show evidence of an event or an injury, or that you had symptoms, treatment, or diagnosis of a chronic condition while on active duty. So if you had an event, like a stressful event that caused a chronic mental health condition like PTSD, you have to be able to show that that event occurred. If you had an illness on active duty that continues to this day, that is something you need to show that you had an illness. If you had symptoms of a condition but were not diagnosed until after service, but you believe that those symptoms that you had in service are related or a continuation of the condition that you have today, that would be a direct claim as well. Now you can do one of several things. If you believe you have a valid direct claim, you can file that claim without any evidence, with maybe a statement from you, lay evidence, just a statement of what happened to you in the military and how you believe that you're eligible for service connection on a direct basis for that condition. And you can allow the VA to look through your service records and try to find all of the evidence of either that injury or that condition that you believe you suffered from on inactive duty. Or you can get a copy of your own medical records, comb through them, and pull out all the evidence of your condition on active duty and provide that evidence that's taken out, copies of those records. You can file those with your claim as evidence of the condition that you believe you had on active duty. So I talked about evidence for a secondary claim. I talked about evidence for a direct claim. Both of them require evidence that you currently have a chronic condition and evidence that it is secondary, at least as likely as not, secondary or a direct result of your active duty military service. Now, I do not recommend that any veteran file a VA disability claim without any evidence, because if you file your claim without any evidence, you may not meet that burden that burden that the vet is required to show that you have a well-grounded claim. Many veterans don't understand that when they file a disability claim, it is up to them to show that they have a well-grounded claim. If you don't show evidence that you have a well-grounded claim, the VA may not trigger the VA's duty to assist. It may not make them or implore them to ask for a C&P examination to fully evaluate your claim and ask for a medical opinion on whether or not your current condition is secondary to service. You really have to trigger that duty to assist by showing that you have a well-grounded claim. And a well-grounded claim is that you do currently suffer a chronic condition that causes a loss of function, and there is plausible evidence that it's secondary to your active duty military service, either directly or secondary to a service-connected condition, or you have a current condition that is aggravated by service or by another service-connected condition. Don't let your case get stuck in the gathering of evidence phase. If you don't meet that burden of a well-grounded claim, the VA will keep asking you for evidence to try to see if you have a well-grounded claim, because they're not going to waste their time and their resources evaluating a disability that's most likely not related to service, or evaluating you for a condition that was acute that completely resolved and you don't have a current chronic condition that causes loss of function. At Vet Comp and Pen Medical Consulting, we specialize in helping veterans develop clear and unmistakable evidence that shows that you have a chronic disability that causes a loss of function, and two, that it is in some way, at least as likely as not, linked to your active duty military service. I recommend that if you don't use our services, that you follow my guidance and develop the best medical evidence to meet that burden of a well-grounded claim in order to trigger the duty to assist, have a compensation and pension exam, and get the best opportunity to get service connected for your disability that you medically qualify for. If you are denied and you feel like you're medically qualified, look us up at Vet Comp and Pen Medical Consulting and see if we can help you. Thanks for listening.
The information contained in this video is informational and not professional advice. Rely on it at your own risk and see a qualified medical or other professional to discuss individual circumstances in all cases.